It should be a little louder, I think.
Okay, let me turn up my volume a bit more. How's that? Is that
There
better?
you go. Can hear you
Okay,
now.
great. Thank you everyone for joining and welcome to the third edition of the Innovation in Corrections webinar series. My name is Chris Poulos. I'm the Executive Director of the Center for Justice and Human Dignity. Our mission is safely expanding alternatives to incarceration while improving conditions both for people who are incarcerated and for correctional staff as well. And these webinars are a partnership between CJHD, the Clements Initiative, and the Correctional Leaders Association. So thank you all for taking the time to join us today. I want to introduce our co-host of the webinar first. That's Dr. Lisa Clements joining us. And Dr. Clements is a Senior Behavioral Health Advisor at NRI, which is the National Association of State Mental Health Provider Directors.
Program
Okay.
directors, research.
Program directors.
Yep.
Okay. I wasn't sure if I would get that or not, but I did. I think I'm finally getting the hang of things here. And also a fellow with the Bureau of Justice Assistance at the Department of Justice. And Dr. Clements is here representing the Clements Initiative. And today we're also joined by Director Rob Jeffries of the Nebraska Department of Corrections Services. Director Jeffries is also current president of the Correctional Leaders Association, and he serves on the board of directors for the International Corrections and Prisons Association. Thank you all for joining today. And the topic of today is a little bit different than our first two webinars. The first one was with Maine director. Second one was with Ryan Thornell from Arizona. And this one, we have a new specific theme, and that's the partnership between community and departments of corrections, something that Nebraska has really leaned into. So with that, I will turn it over to Director Jeffries to introduce the folks that he is joined by today. Thank you.
All right. First, let me thank you, Chris and Dr. Clements, on this awesome opportunity to go ahead and share some of our best practices that we're trying to achieve here with Transform Nebraska. And so to be able to make that happen, I want to introduce our team here, let them introduce themselves, because we want to have a dialogue about how each particular division and community partner helps us to facilitate our main goal is that's to reduce recidivism and increase the success rate. So to my right.
Hi, everyone. I'm Dawn Renee Smith. I'm the Deputy Director for the Rehabilitative Services Division of the Department of Correctional Services here in Nebraska. And my division includes reentry and programming that happens before release, and then reentry as it leads into the community and partners with our numerous providers in our state, two of which are here today.
Hi, everyone. My name is Casey Parker. I'm the Executive Director of the Mental Health Association of Nebraska. I run a peer-led organization, meaning that the people that work for me, and including myself, are people with lived experience. And I'm excited to have the opportunity to talk to you all about our partnership with the Nebraska Department of Corrections.
Hello, my name is Diane Good-Collins. I am the director of the Reentry program at Metropolitan Community College in Omaha, Nebraska. And I have the joy of working with NDCS and providing prison education programming. And we also host the largest on-campus reentry center in the nation. Thank you.
So this is our team. So we're ready to go ahead and, answer questions or have discussions and, provide some insight as to how we're trying to achieve the best possible outcome.
Excellent. Thank you so much for joining us, everyone on the call, and certainly for those of you who are in the room today and sharing your expertise with us. I have to say that this webinar is really, really exciting to me, because having someone who is representing mental health front and center is just a whole new take on what we're doing within corrections, right? And so I look forward to hearing about your work, and certainly we'll follow it closely from here on out. So, Director Jeffries, you and I have chatted a number of occasions about the work that you're doing in Nebraska. And I had the opportunity to review your strategic plan. And by the way, if those of you who are on the call have not yet seen Nebraska's strategic plan, it is a living, dynamic document and certainly worthy of checking out. But within that, there's a bold statement that you make right up front when you talk about the work that you do, and that is that reentry begins at intake. Can you share with us how you implement the principle of reentry beginning right when someone comes in the door?
Correct. So thank you for that question. And I'm going to start the answer, but I definitely want to get into the subject matter experts who's responsible for the work that we're doing as far as our reentry pathway. And so a lot of times we look at individuals coming through the system and they're just trying to figure things out. So what we want to do is take that opportunity in the very beginning to start laying out a plan and a blueprint for what they need to do to address their behavior, what they need to do to increase their aptitude so they can, be successful throughout their incarceration and start thinking about their reentry plan at the very beginning. So what is your goal? Let's start looking about your goal, your end goal at the very beginning. Let's not wait till 30 days, 60 days, and then try to come up with a plan. And so that's been like our breadth of how we're trying to achieve this transformation change in the state of Nebraska. And Deputy Director Don Renee Smith has been instrumental in creating those reentry pathways. And if you can go ahead and just touch on those just a little bit further.
Sure. So one of the things that we do here in terms of programming is we teach a class called the 7 Habits on the Inside. And those of you who are familiar with the 7 Habits know that habit 3 is begin with the end in mind. And that's really what this is. When folks come into the system, whether this is their first time or they've been here before, we really want them to start thinking about where do you want to be when this time is over? What do you want to do when you get back to the community? And what's unfortunate is most people, when they're coming in, they say, I don't want to come to prison again, right? That's not a goal. That's what you don't want to do, but what do you want to do? And so we really try to focus in at the very beginning, talking to people about hope. We talk about the fact that they have an opportunity right now to focus on themselves and to focus on how they need to change in order to make life different. The only way we can achieve change is by doing something differently. And so we really focus in on that with folks, and we are reentry specialists, meet with people right away. We use tablet programming to deliver videos from our reentry staff that really talk to people about what this time is all about. We have some reentry resources that we provide right away. And those are opportunities for people to just get started thinking about what they want to do. And we can talk more about programming as we go, but that's really our beginning focus when folks come into the system.
Yeah, and one of the things I'll add, and we'll get into a little bit further when we start talking about the 5 keys and what have you, is that we use the population to help facilitate that transition into our reception as well too. And we'll get into that a little further later on.
So sorry. Another principle that you set out quite early is that reentry and rehabilitation is also the state's responsibility. It's not just a DOC responsibility. Could you speak to the way in which you share that responsibility with the state?
Well, one of the fortunate things earlier this year, I think it was February, we launched Reentry 2030. We partnered up with CSG and CLA and what have you. And so the principles of CSG is for all of us to be, measuring what we're doing. What are the initiatives? What are the goals in which we want to set for this agency? And then the governor's office was on board with us and they helped launch that program. And what that does is it also includes the cabinet members as well too. And so we get total buy-in from the other cabinet members as well too, to make sure that they are providing the services or what their division or what their agency is able to offer for people returning back to the community. I think the other piece, the other third leg to this whole state's responsibility is the community, right? These folks are returning to the community. These folks will need that community support, family, our community partners, everybody because that's where their success is, right? And so we want to make sure that everybody understands what the need is as far as folks going back out into the community. And so that's why we wanted to have our community partners involved with that. And so that's no better way to transition into, tell me what you do.
So yes, we are very fortunate to be able to work with the Nebraska Department of Corrections. Like I said, all my staff are people with lived experience. And Don Renee just said a minute ago about, it's not about quitting things and not coming back to prison, but it's about getting to do things. And so we are the people that maybe live with mental health, substance use, trauma, have been incarcerated before, and we get to walk the walk and talk to people inside of the prison that they get to, go to work every day. Because now they are realizing, now that they're in prison, that that's a privilege, driving and going to work and paying taxes, things we all complain about, but that those are privileges and that we get to have the opportunity to do those things. And so we are able to certify people in intentional peer support. It is a evidence-based practice. It's a 40-hour training, so we're not just hanging out and talking about what works for us, but it is very intentional in the techniques that we use. And we get to start, like they both said, from the beginning. When people first start their sentence, we are allowed to go inside the facilities, make connections with people, build relationships with them as peers. And then when they re-enter the community, we also have transitional housing, supported employment, rent-wise, some of these supports that we could put in place. But above all that, it's the relationship and us able to learn and grow together and hopefully move forward in recovery on a different journey and learn new ways that weren't helpful, that are different from those ways that weren't helpful to us in the past.
Yeah. And Doc, let me dial back and level set. If Don Renee can talk about the partnerships we've created with our other state partners, you can just touch on those just a little briefly, real quick, and then we'll transition into Diane.
Yeah, sure. It's been really great as we've launched Reentry 2030 to work with other state agencies and to really connect with each of those agency directors and their teams. Over the years, Nebraska, I feel like, is a very collaborative state. We work well together, but it's been pretty intermittent and kind of haphazardly over the years. And so what this initiative has done for us is really made our conversations much more intentional and purposeful. And it's really been incredible to see how those other state directors not only have ideas about what their agency can do, but really have ideas about what our agency can do and things that really haven't even come to our minds yet. And their perspective is really helpful. So that's been a big part of the Reentry 2030 initiative.
And it starts with the governor's office. I mean, he's been totally bought into this, and he's given us opportunity at the cabinet meetings to talk about what the needs are. And so that's when we come to the slogan, like, it's just not the department's responsibility, it's the state's responsibility to ensure the success of people going out.
We have a question that came in. What would be a high-level introduction to what is Reentry 2030?
So Reentry 2030 is an initiative spearheaded primarily by the Council of State Governments, and what their goal is to reduce recidivism by half, as I think is what their goal statement is, reduce recidivism by half by the year 2030. And so for Nebraska, we focus on, and the initiative itself focuses in on economic mobility and on mental health and on housing. And there's a couple of other things that are included in that. But when we think about economic mobility, that really goes to meaningful work and education and all of the other things that go with successful living really play into that economic mobility. And then we also have a pretty heavy focus on mental health as well, both inside and in the community. And so that's really the goal, is to get states on board to commit to what are we going to work toward. And again, it's an opportunity to be very focused and very intentional about the work that we're doing. We know what gets measured, gets done. And so when we're really looking at those numbers and paying attention to what our recidivism rate is, and we've flipped that around, and we've said we're going to try not to focus on recidivism, we're going to focus on reentry success. So currently, 73% of the people who leave our care don't return. They are successful in the community for at least 3 years after they leave our custody. And so we want to create an opportunity to increase that reentry success rate from that 73% up to 82% by the year 2030.
I love hearing those ambitious goals. So you talked about, in preparation for today's meeting, when I asked about an example of state responsibility and what that looks like for you, we talked about something as simple as gaining documentation that you need to obtain a job or to obtain a driver's license. Could you talk about the process that you use as a team and engagement of community to make sure that those kinds of processes work for individuals who are being released?
Howdy, Diane, Renee.
So our goal really is to make sure that it happens inside, because there are so many things that our community partners do for people when they get out that doesn't need to be one of them. And so we have a partnership. So this goes back to the state agency connections. And so we have a partnership with Vital Records where we can send them batches of applications. We get birth certificates back. We hold those on file until people leave. And then we also have a partnership with the Department of Motor Vehicles, where they actually have mobile DMV stations that they bring into our secure facilities and are able to get people a state ID. When people come in, we immediately send that information off to the DMV, and they let us know whether the person has an active license, if they have a suspended license, if there are fines and fees, things that we can help them get taken care of before they release, so that we can renew that driver's license if possible. And if not, then we work on at least getting a state identification card so that when they leave here, they're ready to go. We also have that partnership with the Social Security Administration and apply for those replacement cards about 120 days before people leave. So, and while that is our goal, there are people who still end up leaving that don't have one of those things. And so our community partners definitely assist with that. But the last thing we want is for one of them to be sitting, for 4 hours at the DMV with a reentrant. We want them to be providing services that we can't offer.
Diane, you want to touch on anything when there's documentation not there and they are in need of it? How do you help facilitate that?
Sure. So obviously, as a college, we do focus on higher education. But when people come in, we are trying to address their immediate needs, much like Casey. So while we do partner a lot with Casey and the NDCS reentry specialists, there are a lot of barriers that the individuals we work with may have, like if they have a out-of-state birth certificate or something that for some reason they were not able to get one while they were incarcerated, then we are sending those birth certificate applications out. We will take them to the DMV if need be, or the Social Security Administration. And it is a lot of legwork, but like Casey's organization, 80% of our team has lived experience. There's about 23 people on our team. And so our services mimic a lot of what MHA provides, and we are providing peer support at every level of our work, from the peer support mentors, through our financial aid, through our reentry coaches, and including me. I took my first college credit class while I was incarcerated in Nebraska, and having the opportunity to then share what I learned while I was incarcerated now with so many other people in the state is so valuable.
I
We
was
got another question.
wondering, oh, if you
So
could just
sorry.
explain, sorry, a little bit about that, like the value of people with lived experience, and maybe from Nebraska DOC's perspective, a question on what it was like criteria, and how do you go about having people who have, lived experience going back into the facilities and working with the population and stuff like that.
So we started this program, our vocational and life skills program, through some legislation that was passed in 2014. And at that time, a person who had been incarcerated would not be allowed to come back in to visit until they'd been out for at least 5 years. And we looked at their record pretty closely before we allowed them entry. And so when we started this program in 2014, we knew that we needed to walk the talk, right? So if we believe that people deserve to be given a second chance, we couldn't say only except for when, it comes to coming into prison. And so these two organizations, these two women in particular, pushed very hard, helped us to figure that out, to understand that that was really important. And we started almost immediately allowing people with criminal history to be able to come back in and work as part of their organizations. And so that was happening right away in 2015. There were people that were getting out, and within sometimes it was weeks, sometimes it was, a year later, maybe, but it was soon that they were starting to work for one of our organizations. And so then we were allowing them to come in, and it was a pretty tough sell for a lot of our facility staff. And there were a lot of growing pains, but I think you guys can talk a little bit about how that maybe felt for some of your staff as they were coming back in, and just how it was so important to partner together. I think we've definitely turned the corner, and the majority of our staff really get it and get why your staff are so important.
Yeah, I think it, initially, like you said, it took a little bit to earn that trust, right? Rightly so. We need to earn that trust. And I think once we did our first group inside the women's correctional facility, and they started to see some of the positive change in the women and the connection of people that they were incarcerated with coming back in, and now they're employed, and they got connected with their children, and they are buying houses, and they're just doing really well. And so for the women at that point to be able to see that gave them hope and the desire to do something differently. And then I think that's when the correctional facility staff and the correctional officers in that facility were able to see that change, and the reentry specialist at that time was also a huge advocate because they participated in the meetings that we were having on the inside. But that then allowed the door to be opened up to more facilities and different populations of people. So much even that we got to start meeting with people who were in restricted housing.
Yeah.
So it took time, but it also has a huge impact on the person who is being allowed to come back inside, because it gives them purpose that they can now use what was once held against them for employment purposes. To now it gives them a purpose to be able to give back to their community, which they took from in the first place, but also to again be that hope, probably, for somebody else on the inside that says, well, they can do it, maybe I can do this too.
And
Go
real
ahead.
quick, Chris, and it just speaks to the initial question Dr. Clements asked about, the state's responsibility. And so we're all in. I mean, everybody from the front to the back is part of this whole Transform Nebraska and trying to bring about a better outcome for our state.
Excellent. We have several questions in the queue about reentry. And Chris, I'm hoping since you're on the board of Reentry 2030 that you can respond to some of those in the queue perhaps, and particularly the number of states that are involved. I want to move to a couple of other things, and then we have plenty of time for questions at the end, and then we can pick this theme up if that's okay with you and follow up on it a bit more. You're talking about something that is can be controversial, Director, and we've talked about how you field the comments and the pushback and the folks who don't necessarily support the approach of a strength-based intervention with individuals who are incarcerated, and that talking about empowerment and personal growth seems a little bit light on punishment. And so I wonder if you could talk about how you walk that line and make sure that individuals do the time for which they're in prison, while also having opportunities and a focus on growing and getting out.
So that's a loaded question right there. I mean, I'm gonna have to break that one down a little bit. So I mean, let's just talk about, what the mission of this particular, this field of criminal justice is. And that's to improve the lives of folks who've been, sentenced to serve their time for a crime they committed, right? And so in that mission, we have folks who have to be part of that mission, not just us sitting at this table, but we have a whole slew of staff who have to be involved with that mission as well too. So to get them up to speed, we need to invest in the people of our staff. And I can refer to our strategic plan about how we get our team members engaged about making sure that they are well taken care of and trained up, and resources are available for them, because we're going to need them to fulfill our mission, right? So if I'm invested in them, and if we can increase their well-being, then that cultivates a culture for success. And then we get the population involved, right? So we went to this peer specialist model to where we are training our population to be facilitators along with our staff, so they're involved with the success of our mission and we're moving forward. And then there's this whole thing that we call policy, right? So everything we say we're going to do, we're going to put it in policy so it's consistent across the board. So everybody knows what the expectation is for what our mission is, what is our programming, what is our training schedule like, and oh, by the way, how do we get people prepared to be released out into the community? So those are essentially the model in which we're using our strategic plan to get people informed about what we need to do to be successful. And oh, by the way, success is just not the responsibility of this agency, as I said before, it's the responsibility of the state. So as we know as an agency, that we play a vital role in making sure that everybody is fulfilling the mission, we're moving forward in the right direction. And so everybody's bought into it. And so what that comes next is, what are we doing as far as programming? We've changed several different things on how we're doing programming, made access, like it's never been done before with the tablets, with partnerships with Viapath. I'm doing some shameless plugs right now at Edovo. But we tailored all that to get to our 5 key model, right? And the 5 key model is based on a strength-based model and doesn't concentrate on the deficit of somebody's behavior in their past practice. And so I'll let Dawn Renee get into those dynamics of the 5 keys, because this is a new model that, it's been done, it's been piloted in 7 other states, phase 1, phase 2, but nevertheless, it has not been done inside the facility. And so this is the first time we're doing this particular 5 key for well-being development inside of a facility as our case plan moving forward to get people to successful reentry.
So the 5 key model was developed by Dr. Carrie Pettis and some other researchers who identified that well-being was a really important part of reentry, and increasing a person's well-being was going to contribute to their success to reenter. And so they found, they studied, they looked at over 100,000 different studies and research, thousands of research articles, and they identified these 5 key ingredients that if they are available in abundance in a person's life, that their well-being is increased and their ability to reenter is significantly enhanced. And so you can see those up on the screen, what those 5 keys are. And so what's different about this model, in addition to just the idea of those 5 things, is also that it doesn't focus on what we focused on for years is risk, need, responsivity. And that's what we look at. We identify what a person's risk is. Many of those factors are static factors that don't change. And then really, we don't see a huge change over time either in a person's risk. And so this model really flips all of that over and says, do we need to talk about risk, or do we want to talk about building these strengths, building these 5 keys, building them up? And so there are a couple of things that are really different. We do a what they call the Reentry Wellbeing Assessment Tool, or the RWAT. That is done at the beginning when a person comes in, and then identifies maybe where some areas that they can work to focus on out of these 5 keys. The really key part of this, the important part of this, is that it's really up to the individual. And that's very different. As you know, in corrections, the one thing that we are really good at is telling people what to do. We love to tell people what to do. And this model says, we don't need to tell people what to do. Everyone, including, I'm guessing there's no one in the audience today that would say, I don't really need healthy thinking patterns. I don't really need effective coping strategies, right? We all need those things. And so this is a model that was built for people, not specifically just for incarcerated people. And so it really just makes so much sense to folks. And so what happens is we identify where they are in this kind of on this continuum, but then allow them to decide, where do you want to put your focus? Where does this person want to, maybe we see that really what they, where they're lacking the most is in that healthy thinking patterns, but they say, what's most important to me right now is working on positive relationships. All right, let's work on positive relationships. And so we get them into those classes right away. And we have another slide that shows the programs that are available in each of those keys. And so this here we talk about, so it shows you what things, what programs will directly contribute to that. And so when someone says, I want to work on effective coping strategies, then we identify Power from Within is the class. There are multiple, several different modules. Those are all taught by peers, and no staff are involved in those, in the delivery of those programs. And what we know from both our providers and from folks that are working inside, that peers come with a built-in credibility, and they want to focus on improving those strengths. They're not interested in talking about risk either. I think, you know, Director Jeffries was speaking recently and said, you know, nobody wants to be told what you're not good at, right? Nobody wants to focus on that. Well, I don't want to focus on that, and neither do they. And so this model really tries to focus in on what's going well and what can go even better.
I really don't want to move away from this, and I'm wondering if we should just allow time for the audience to weigh in, and maybe this is a time that we can move to questions. Is there anything else, Director Jeffries, that you want to make sure we cover?
Well, you know, I can't say enough about how awesome this opportunity is to present with these 3 people because they are carrying a heavy load and making sure that we are fulfilling our mission. And so this just speaks to, you know, and this is just one state. I mean, there's a lot of folks doing a lot of good work out there. I mean, I can do a shameless plug to a good friend of mine up in Michigan. If you ever hear anything about the vocational village, where they've created this whole village and getting people employed, ready for jobs that are currently vacant in their particular state up in the state up north. That's Director Heidi Washington. I'm from Ohio, so I don't say the word Michigan too much. So nevertheless.
Well, let's move to questions from the audience. We've had a number of questions about reentry, certainly, and about peer engagement and reentry, and just a lot of very positive comment, Director, about that your work that you're doing related to preparing people for leaving prison. Before we go to questions, though, there's just one question, since this might be my last chance. I want to ask you. You carry a heavy load every day, and I'd like to hear from you what you see as the most significant sort of arrow in your quiver, right? Like, what is the one thing that for you as a leader is absolutely essential to supporting your team and the work that they do?
I think it's you know, these roles are difficult. I mean, I'm not going to tell you that we've got it all figured out. It's 50 of us, right? And we constantly use each other. I mean, not use each other. We talk with each other to see what's working and what's not working. And sometimes we talk to each other when we're having bad days. And we do have bad days. It's not a matter of if, it's when. But the one thing that I know for certain, not just for me, but for my partners out there, is we're pretty committed, and we understand that this is just not a job, it's more of a purpose, right? We feel that, you know, if we're only on this earth for a short period of time, right? And those who are fortunate to live beyond their average age of 80 or 70, you know, good for them. But for this particular time where we're here, we have to be meaningful, and we have to be purposeful in what we're trying to contribute to humanity. So with that, I mean, it's easy for all of us. So when we have bad days, we know we're going to have good days, because we know the reward is so much better because we're impacting lives. And I believe that, you know, and speaking with my team, you know, we joke around, we have fun and all of that, but that is the number one focus, because we're not in it for the money. We're in it for the outcomes to improve the lives of those folks who've been, you know, unfortunately found their bad times on bad ways. And so that's it. I mean, think about recidivism. Think about the incarceration. It just doesn't impact the person who's been sent to prison. It also impacts the family members. It also impacts the victims. It also impacts the community. It's the whole ecosystem that we have a pivotal role in to ensure that thrives, and these folks can go back out and be contributors to that particular ecosystem. And so that's the mission. I mean, it's a much once you understand what your purpose is in this, I mean, the universe will find a way to make it happen.
Yeah. Excellent. Really, really appreciate your comments. I've had the opportunity to interact with you and your team several times now, and it's apparent that you hold tremendous respect for them and vice versa. And I think it really creates an incredibly productive team that you have working with you. So let's go to questions then, if you're okay with that. And Chris, do you want to start out with a couple of the ones that I see you've been responding to? Is there anything that you'd like to bring out within the questions that have been submitted or ask?
Sure, great, thank you, and great to listen and learn from you all today. The director of Reentry 2030, I texted Jesse Kelly. Everyone calls Jesse Kelly, no one just says Jesse. So Jesse Kelly, there was a question about Reentry 2030. It's being branded as a 50-state campaign. So far, there's only a handful of states signed up. The question was, what's being done to get more states involved, and are there ways that could make states be more interested in possibly getting involved and becoming part of Reentry 2030? And I'm not sure if we have the ability to have, oh, Jesse, you can, okay, great. I wasn't sure if you could actually join and speak in the format, but you can, so I'll be quiet.
No,
Welcome,
I
Jess.
can. Good afternoon, and thank you so much, Chris, for pinging me with this question. I'm really excited about Reentry 2030. I joined the Justice Center just about 3 months ago, and we are taking some really sort of aggressive steps to make sure we're building some national momentum when it comes to the Reentry 2030 initiative. We have a huge goal to improve reentry success by 30% by the end of the decade. And so, like, what does that mean? For us, we want 600,000 fewer people admitted to prison from supervision each year from now until 2030. And the way we do that is by signing on states, working with state departments of corrections to set their own individual and specific state goals. And then we tailor technical assistance to each state to help the state meet the goals that they have established for themselves. If I can share my slide, I'm happy to sort of pop up one quick slide that I have, and I think I can. These are some examples of what states have listed. So right now we have 6 states signed on. We do anticipate 3 to 5 more states joining in the first quarter of next year. So we really are seeing a big push about who is coming on board and what kind of goals they're listing. You can see that we have goals around homelessness, behavioral health, access to vital records, and then some states have general broad goals like reduce recidivism by 50%. And the way that that's been tackled is that a state has developed a reentry task force. The task force is meeting monthly. They're setting a strategic plan. They're building out sort of subtasks to help them identify and meet their goals. And then another thing I'll say, and then I'll pause. I don't want to take up too much time, but you'll see here that every state goal has an attached metric. And so the Council of State Governments is working directly with your research team, any other folks that you have in the state that have shareable data to see what your baseline is, what the starting point is, and then how we can build up to those bigger goals. And, you know, it has been just an absolute pleasure to work with Nebraska, and we're really excited to hear that this issue sort of sprung up from the ground up today. And I'm excited that I was able to join for a few minutes, but I'll pop my contact information in the chat. I am so happy to talk to anyone about 2030 anytime you're ready to get it started in your state.
Thank you very much, Jesse. Appreciate you joining, especially with no notice.
That sound kind of playing right there.
So there are a bunch of other questions. I don't know if Dr. Clements, let me see if I can look and see what we have. Or if Rachel, you see any that have not been answered yet, especially if they relate specifically to Nebraska.
I've got one. So what have been some of your favorite community-based programs?
We have 2 right here. We'll start with those. But I think all of our VLS partners, they do very different things. And so I think really the programs that utilize peers to the greatest extent are really some of the best programs that we work with, because it really does make a difference to people, both on the inside and the outside. It's doing kind of double duty. So Diane, if you want to talk maybe a little bit about what your center does in particular, I feel like there's a good opportunity there.
Sure. So at the Reentry Center on campus, we have a job center, a career readiness center, and we have 3 full-time people working with 390 employers in the Omaha area, every industry, every pay scale, to connect the population to employment. Because realistically, when people are transitioning out, their first thing isn't, I want to go back to college, right? Or continue their college pathway. Typically they're pausing, but they do come back. And so our goal as a community is to help connect them to their basic needs. So whether that's food, hygiene, so we have a pantry on site, we have a computer center on site. I mentioned earlier that we have an education center with reentry specific advisors, financial aid team members. But again, we do have 3 people dedicated to employment, because that is the next step as people are transitioning to the community. So we work with the incarcerated community work release center. We bring them on campus. They're engaging in not just job seeking, but preparing for the workforce. So creating that professional readiness and attending all kinds of life skill classes, but then also like Casey's program, peer support groups. We have peer support groups, recovery groups. We have things going on campus 6 days a week, and we're open into the evening hours because that's not always convenient, the Monday through Friday, 8 to 5, right? But to go back to what you were saying, like the value of what we do is recognized by the NDCS staff too. I mean, some people at first, like in the beginning, it was a little resistant, but now they're using our success with our team members and telling people in the facility, hey, did you know that Diane used to be incarcerated and she took her first college credit class in prison and she, look what she's doing now. She's helping other people. Or did you know that a member of her team was blah, 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 and using that to highlight and to infuse hope into the currently incarcerated population. And I think that is just as valuable.
I don't know if it's, I'd like to add just that, and like Don Renee said, there's quite a few of the grantees, and what I've really come to appreciate over the years is our partnerships. I didn't know Diane before we started doing this work. And, we're opening up 2 more transitional houses in the Omaha area. And so we're hoping to have your employment specialists on site at our house. And, we all, the need is so great that we all have to pull together. And my experience in years before, it was often a competition based on, dollars available and funding sources. And so what I've really appreciated that the culture that NDCS has created within the BLS grantees is for all of us to work together and pool our resources and wrap around people both inside and outside. And it's why I get up every day, because I love my job.
And I will add that I've been to both of these establishments, and I had the best time getting out of the office and spending the day in their houses.
That's what it's all about. So
Yeah.
there's another specific question about your reentry specialists. And the question is, how many reentry specialists and peer support mentors are assigned per facility? And are the classes and the approach available at all facilities?
Yeah, so the 5 key model is available at all facilities. It's our core programming. So we have the programs that are associated with that, along with just a couple of others, the 7 habits I mentioned earlier, and a couple of volunteer programs that come in, and really that's it. It's all focused on that 5 key model. So Nebraska is a fairly small system. We have just under about 5,700 people.
5761.
5761 people incarcerated today. And so of those, we have 225, I believe, that are trained peer facilitators, and they can deliver programming. So they've been trained to deliver 1 or more programs. And then we also have folks that are trained specifically just in intentional peer support, where they're not delivering necessarily the 5 key programming, but they're providing that regular peer support to individuals on a one-on-one basis. And then our reentry specialists we have 12 of them, and then we have 2 case managers that work with them, but 12 of them for the 9 facilities that we have. And so they're working with individuals about 6 months before they release. They meet with them at first, and then they meet with them again as they get closer to release to finalize reentry plans and work on those plans.
Excellent. So someone else is asking about family involvement, and she asks, at what stage in the process do you begin to incorporate them into the process in family support for reentry?
So I'm going to say that's something that we're not great at today. We can be, that's something we can do a lot more of, is incorporating that into the planning process. When it comes to housing, we're talking to family if they're involved in that housing plan. And so that's really important. We have our reentry specialists have some pretty frank conversations with moms and wives and husbands and grandmas and whoever the person is saying that they want to go live with about whether or not that's a really good plan and whether or not it's the right thing for the family and for the individual to go back to that place. But I think, and you know, we focus in on visiting. We really want to increase those visits in person, but we also have free virtual visitation that we offer to people, as well as you know, paid video visits through our tablet provider. But we really want to do more with that. And we actually just received a grant to do a program called Support for Families. And it's really focused on working with the families about their healing and their getting them back to where they need to be, not so that they can be a support to their person who's incarcerated, but so that they're healthy, and really focusing in on them. And so we're just beginning that grant. And so the next time I get that question, I'll be able to say that we do that really well.
Excellent. Love it. All right. Any other questions in the queue that we have not responded to, Chris? Or anything else that you want to ask before we begin to wrap?
Let's see, I think there was a question about if another state wanted to start doing reforms like you all have and making similar progress to you all have, where would they start, or who would they start with? That was a question that was sent to me via chat.
So we've had multiple states. We have one state coming in a few weeks to look at our programming with the 5 key model. And we're super excited about that. Anybody that is interested, please don't hesitate to reach out to us. My email is a little bit long, but it's DawnRenee, all one word, .smith@nebraska.gov. And you can reach me anytime. I'd love to talk to you about what we're doing and connect you with Dr. Pettis, who created the 5 key model. I think that's a really important part of this. And then also all of our providers are open to working with folks in other state communities, as well as for, you know, the prisons system itself.
But Chris, I would also make mention that I would encourage folks to, whatever they decide to do, they need to bake that into some type of strategic plan that has some metrics with some outcomes in there. So you know what you're doing and you know what you're measuring. So you know if you need to course correct or what have you. But nevertheless, your team members, talk with your team. I mean, they know what needs to happen, right? So you don't have to throw out one, you know, program to gain another program. You can probably infuse the two, such as what we've done and everything. But please create a strategic plan that's meaningful and that is working, that has outcomes, so staff can see the direction that you're going.
Right.
I would
Director
mention-
Jeffries, there's one last question, and that's how do you decide what community groups to work with?
All of them.
There you go. Excellent.
All of them. Because somebody has everybody has something to offer. And if you're talking about all in with the state, you know, then everybody should be part of this solution going forward. Now, funding could be a different thing, but nevertheless, if you got funding, you got to create a funding source for folks to apply for. But if everybody wants to be involved and whatever they bring it to the table with resources, what have you, everybody.
That's right. All right. Thank you. Chris, you'd like to talk about closing up today or wrapping it?
Sure. Thank you, everyone, for joining the webinar. It looks like we have some folks willing to touch base and give more information afterwards, both from the Nebraska folks and Reentry 2030 folks. You can reach out to me or to anyone who shared their email with the group about this. So